Today, we're going to learn about a clinic located in Fort Pierce that is changing the way that healthcare is being delivered in a positive way for the physicians and their patients. Dr. Jessica McCain is the founder of Southern Comfort Health Direct Primary Care, and she is part of a growing movement that is making medicine personal again. So welcome back to the show.
Oh, thanks so much, Ellen.
Yeah, wonderful to have you here.
I appreciate it.
We have a lot to talk about. We're going to jump right in. I want to know what made you want to become a primary care physician and open up your practice?
I knew you were going to ask this question, so I've got like a part one and a part two.
Yes.
So we'll just say, how did I become a primary care physician first, and then why I became a DPC doctor?
Yes, second.
I'm just a driven person. I always take opportunity that presents itself. I can remember, everyone what's that moment you wanted to become a doctor? In fifth grade, when they were telling us about middle school, the orchestra teacher for Lincoln Park came and said, if you actually are in an interview for medical school and you've played the violin, you're going to get into school because you've got hand dexterity and you've got poise. So I was sold. I had to learn the violin then. And I think I always had that in my mind, that I'm always going to take every opportunity I have to better myself. And it's been a combination of teachers and mentors who have led me to my career, my calling as a family practice physician. Because they challenged me with advanced coursework. They fostered my skills and discipline. I played sports all through into college, and I majored in exercise science. I was well-rounded with a lot of volunteering. I volunteered with the Alzheimer's Resource Center and hospice. And while I was in school, I also worked. I worked as a resident assistant in the dormitory, as a teacher assistant for organic chemistry and immunology. So I always had a lot on my plate. And then I also was exposed to life. I lived abroad in Grenada for 2 years, in New York, in Miami. So I've been experienced with a lot of different cultures. And I bring this up because, I'm well-rounded, and all my experiences have led me to be a little bit more relatable. And I think that's what makes me able to be a good family practice physician. You don't really decide what kind of doctor you're going to be until actually after medical school, when you've gone through all your rotations. And it just happens that when you like every rotation, you tend to gravitate towards family medicine, because primary care is the front lines of basic needs.
Yeah, you touch everything.
Exactly. We do the whole body, the whole person, but we also care for their families and for the entire breadth of life. So I just like the idea of something that I can be, always continuing to learn, and just always finding community resources and helping people